and then hello everyone. For folks in India who are joining us, very warm welcome. Good evening to all of you. It's 8:30 p.m. in India. Folks here in the US, in the East Coast, it's a nice, bright, lovely summer morning, late spring morning. So warm welcome to all of you. Today is a special day. It's a World Accessibility Day, or sometimes called Global Accessibility Awareness Day. And on this day, we are very pleased to host a very unique event, and we are honored to have Mr. John Rochford with us as a speaker. And I will have to spend a lot of time to actually talk about John to do any justice to his many talents, skills, accomplishments, and profiles. I will just share a few items. John is a program director and faculty member at the University of Massachusetts Medical School. He's the founder of EasyText.AI. We'll be hearing about that. John is interested in data science, in AI fairness, and a renowned expert on web accessibility. He is one of the founding members of the Boston Accessibility Group, and John and I and others at VisionAid have had the pleasure of working closely on the Boston Accessibility conferences. John is also an expert speaker for the United States Department of State in the areas of accessibility, AI fairness, and related topics. So, and as well as the W3C and many globally renowned bodies. So we are very fortunate to have John here. There's also a personal connection with John beyond a personal friendship, which we built up over the years. John has been a very strong advocate for the cause. He believes in what VisionAid is doing. And, it's always hard, any of us who have tried to get a job, or the first business, you always know that getting that first job or the first client is always the hardest part, because everyone wants to know what your experience is. So when we launched the Digital Accessibility Testing and Training Center, John actually took a leap of faith and said, I'm going to work with you. And he actually organized a paid project through one of his contacts. And so we'll always be grateful for that. There's always that first project is always the one which is the hardest. And since then, it has been on an upward trajectory. We continue to do a lot of work, but always grateful to John for taking that leap of faith. And I know that he and his team were very pleased with the work which was done. John also publishes blogs, and anyone who's interested in the topic, they should visit this blog, Clear Helper, which I'm trying to find here. And the Clear Helper blog is an excellent blog where he publishes this, what he calls 1-minute reads on different topics of accessibility. There's excellent stuff here. Recently, John published a 4-part series on VisionAid. And in these 4-part series, you'll actually learn more about VisionAid than anything we published ourselves. So it's really an excellent job in summarizing different aspects of our work. So I encourage you to look at that. We'll also be talking about different websites in the course of the event today. So along with this milestone, we also have, unfortunately, another grim milestone. Yesterday, India surpassed the world record for the number of deaths related to COVID. So a very tragic milestone, which is very troubling for all of us. So COVID is raging on around the world. And so today's topic brings together the topic of COVID and accessibility. And John is going to be talking about how to make COVID information accessible, in countries like India and other places. He has done some groundbreaking research in this area, and we are excited to hear about what John has to share in this regard, because governments are scrambling to put out information, and sometimes this information is not accessible to persons with disabilities. So we'll understand some of these challenges, some of the work which John has done. So with that introduction, I will now hand it off to John. And I will, in a moment, unmute John. And John, you should be able to unmute yourself as well.
Yes. Can everybody hear me, I assume? So, hi. Thank you, Ram, for that introduction. It's been wonderful for me to be able to work with you and VisionAid, and over the many years now. And I'm just so happy about it. I really am. I love the work you do. So I've been at the Eunice Kennedy Shriver Center, which is part of the University of Massachusetts Medical School, for over 20 years now, and actually the Shriver Center for over 35 years, something like that. And what I've been doing is focusing on technology for developing web technology to make the web accessible to people with cognitive disabilities. That's my focus, but it's much more broad than that, as Ram described. I do a lot of work internationally to help make the web accessible to people who are blind, in particular, but other physical disabilities. But my specialty and passion is people with cognitive disability. I could not be successful in what I do at all if it wasn't for the diverse groups, teams of people with whom I work, that I supervise. These are people from all over the world. They are of all races and international. Get a little excited here. Many countries, people with disabilities, women, people who are older. We really are a diverse group, and what a smart, passionate, hardworking teams these people are. I am here today to talk about an exciting project of ours that we have been developing and for several years now. And essentially, what we're doing is we are so the background research, the foundation here is that we are developing and training artificial intelligence to simplify web text on a mass scale. And we are doing that because people in every country, there are huge populations of people who have cognitive disabilities. So for example, people who have intellectual disabilities, autism, dyslexia, ADHD, etc. And also, well, really everybody as we age are acquiring cognitive disabilities. We're acquiring executive functioning problems, memory problems, etc. So when I talk about cognitive disabilities, I'm really talking about a wide spectrum that includes everybody. And there are other huge populations, such as people with low literacy, people who are not native language speakers, the deaf. The deaf they grow up learn that sign language is their primary language. So they read at basically a middle education level. They have about a middle education reading level, and then you know, seniors, really everybody. Okay, so where this ties in to what I'm talking about today is that we are gathering COVID-19 text from every website of every country. And when I say website, I mean the government websites of every country. So we're gathering the text of those websites, and we are recruiting thousands of people, potentially tens of thousands of people in every country, to help us to simplify the text. It's called crowdsourcing. So we're asking people to look at a sentence that we have taken from a government website, and then we guide them through simplifying that sentence. And then as we collect millions of sentence pairs of the typical sentence that we've grabbed from the website and the simplified version of it, we are going to point our artificial intelligence machine learning model, our AI, to that data set and say to it, you look at these data and you figure out how to simplify text. And the more we can train the AI, the more the AI can independently simplify COVID-19 text, and the less we'll have to rely upon people, hopefully. And another piece of this is that we're starting with English, but we plan to move to, as we achieve success, to other languages. So another thing to understand about this is that we are a problem, a huge problem, is that over 98% of websites in the world, all websites, are not usable by the blind. And that includes all these government websites that have COVID-19 information. And because they're not usable by the blind, that means that they're also not usable by people with other physical disabilities. And in Massachusetts, where we are, one of my teams, it's called, at the University Traverse Center, there's the Index program, and we are the information and referral service for people with disabilities in Massachusetts. And our website, disabilityinfo.org, is completely usable by the blind, people who have any kind of physical disability, cognitive disability, etc. And we plan to build out disabilityinfo.org to be a showcase of how you can make COVID-19 information usable by people with disabilities. And unfortunately, the Massachusetts government vaccine finders and test center finders, they're not usable by the blind. And that's a classic case of the whole world. All of these websites aren't usable, and it's terrible. I can't fix all those things. My teams can't do that. But what we can do is we can simplify information so that the ultimate goal is the more people, the more these huge populations can understand how to quarantine. What does quarantine even mean? Stay at home. That's a simple way of quarantine. And the more they can understand social distancing, stay 2 meters away, the healthier and safer they are going to be, but also the healthier and safer everyone is going to be. So that's the ultimate goal. And our plan, so where we are now in our project is that we have already set up a crowdsourcing platform that people can use to simplify text. We're starting with COVID-19 terms. We're asking people to help us simplify COVID-19 terms. And the plan all along has been to start with Massachusetts and then expand to the other US states and then go to the other English-speaking countries, etc. However, about 2 weeks ago, Jatin, so Jatin is has joined us. He's in the audience now. He's in India now, and he told the team, the Easy COVID-19 team that's working on this project, what a terrible situation that he is in, his family is in, his friends, and he described how, you know, people are dying around him and people can't get health care. And I was, you know, it's one thing to read the news about what's going on in India, but to hear it from someone who is right there and experiencing it firsthand, and somebody I care about very much, it was stunning to me. I was stunned, and I actually was overwhelmed. I had a hard time working that week, which is unusual for me. And so I started thinking about immediately, what can we do to help India? And so what I've been talking with the teams about is maybe pivoting. So instead of, so we would still start with Massachusetts to make our website, as I described, a demonstration website about how to make COVID-19 information accessible. We would still do that, but perhaps instead of going to the other states, we would pivot to India. And so I am really excited to be talking with all of you, because I really need all the information that I can get, all the ideas that I can get about what do people think about this idea, and how do you think that we could make it work, and how could we reach millions of people in India to help us. Another thing before we engage in that conversation is that, so India is in crisis now, and I don't know how long that'll be happening, and I know that people are preoccupied by that, and of course they are. And what we're talking about, this simplification and this accessibility, and is not going to help today. But what we're thinking about is that as we get the information simplified, we will publish it, the simplified version of it, make it available to all of India, and then as that information is simplified, we will start to have a direct impact, because people will understand how to be safe and healthy. Okay, so I've talked a lot, and I've tried to give you the short version of everything. So I'd like to open up the discussion now. So anybody want to ask, say something?
Yes, if anyone, let's see how this goes. I think that we should be able to just have people unmute themselves and speak, but if it gets too confusing, then we'll ask people to raise their hands and do it in an orderly way. But let's try the free form. I think the group is small enough that we should be able to just have a free form discussion. So I'll just to get the conversation going, I'm going to ask Ashwin, or Bhargav if they have any comments to what John said, and then we'll open it up to anyone else.
Ram, yes, indeed. This is a very good idea. This sounds to be very interesting. So we need to understand, like John was saying, that a lot of information is required. So in between, I missed a few things. So information meaning, what kind of information? So information is already available on the government websites. So what is that it's been expected from the crowdsource?
Yeah, so the information that you're talking about on those government websites, yeah, sure, it does exist. And yes. But unfortunately, it's written in a way that is too complicated for many people to understand. And so at a very basic level, even the word quarantine needs simplified explanation. Stay at home. That's what quarantine means. And so people can understand stay at home, but they don't know what quarantine means.
Got it. Got it.
Anyone has any other comments? Bhargav, you have anything you want to add?
Well, I could say more that may engage people.
So John, let me, I have a question, Vijay here. So John, I have two questions. One is, when you collect all this information, crowdsourced information, how do you plan to engage with the government to make this information available or accessible through the websites? That's my first question. My second question is, you also spoke about a crowdsourced platform. So I would request you to, provide more details on the crowdsourced platform, how people in this call can engage themselves in the platform, so what's the process involved and things like that.
Yes. Okay. Well, let me do the first question. The way that we anticipate this happening is that we are going to publish ourselves on our website the simplified information that we are gathering from India. And then we are going to offer that simplified version to the government entities that are publishing it, the information. And it would be up to them to decide if they want to put a simplified version of their information on their website. Another possibility is that we could create simplified summaries, especially of long documents, so that they could just put right at the top of their long pages or documents a simplified summary of that document. So there are different options that are possible. I don't know if we're going to even get that kind of engagement, but the very least we can do is to publish our simplified information ourselves and make it available to the whole country and the whole world. And then in terms of the question about the crowdsourcing platform, so we are using an open source platform for crowdsourcing, and we're in a testing phase now, so I don't want to announce it publicly, but we will be shortly. And of course, we'll need to, and this is part of why I'm talking with you, because we're going to need to market this to the whole world, the whole nation of India. We're going to have to get the word out about it. But essentially, the way it works is that somebody visits the website, they log in, they get their first term, and they see a definition of it, and they're asked to simplify it. So they enter their simplified version into a field, and then they click the next button, and they do that over and over. And as people do that, we are going to be creating a glossary of terms and their simplified versions. And we're also doing some what's called inter-rater reliability, so that we're going to be depending upon the people simplifying to judge the simplification of others, so that we really get the best simplified versions of everything. Did those two answers, are they sufficient, or do I need to?
Yes, John. Thank you. And we'll wait for you to make the announcement, once you're ready, and so we'll get a lot more information at that point, I guess.
Yes, and yes.
Good morning, US, and good evening, India. I have 3 small questions. Actually, I'm a COVID volunteer since last 1 month, and I have questions that are we looking for an app also? This is my first question. And only government information is enough for uh, everyone in India. Thank you.
Yes, well, this is a great segue into part of what I want to talk about. The one thing to understand is that the crowdsourcing app is mobile friendly. However, I know that millions of people in India do not have fast internet connections. And so I don't know what to do about that because we don't have an app, nor do we have the resources to create one that could, for instance, work locally on a mobile device, and then when the person has an internet connection, upload their information to our server. They could work that way, but the only way that it does work now is that they need to have an active internet connection in order to do simplification for us.
Mhm. Okay.
Morning, John. Ankit this side from India. I have a question. It's a bit technical oriented. That as
Before
you
you,
were saying
I'm
that,
sorry. Before you ask it, you're very faint, and I'm not. Could you? I can't hear you well.
is it better now? Am I audible properly? Ram,
Ankit,
can you please confirm?
can you come closer to your mic?
Okay, I am, but I don't know. Vijay or Ram, is it audible to you at least so that you can pass?
Ankit, go ahead and ask your question, and then maybe I can translate that to
Sure.
John.
So my question to John is that as he's saying, his team will be looking forward to simplify the information available in the government websites regarding COVID or that kind of stuff. So may I know what kind of things will be used? I mean, are they thinking of using any methodology regarding data science to make that simplification or something like that? I mean, how that simplification will take place? May I know that?
Okay, John, let me translate that to you. What Ankit wants to understand is what kind of methodology and technology that you intend to use for the simplification of text. That's what he's asking.
Okay. So my colleagues and I have been publishing for a while about our research and development, and essentially the machine learning model, the AI, is based upon a few technologies, primarily what's called natural language processing. And the base of it is neural machine translation. And essentially what that means is that you traditionally, such as what the translate tools do, like Google Translate, is they'll take millions of sentence pairs of, say, French and English, and say to their AI models, look at those millions of sentence pairs and figure out how to translate from French to English. And we're doing the same thing, except that it's called monolingual machine translation, where we are saying, okay, here is a typical English sentence, and here's a simplified version of it. And then we're doing some other things with our model, such as we gathered international and national plain language standards, and we operationalize them. We define them in a way that computers can understand. And And so we are using them with our machine learning model to help it learn what plain language is. And we're doing some other things too. So for example, a huge barrier to this kind of work is that artificial intelligence has no real worldview and no common sense. And the way that that has been traditionally approached is in vertical markets like airplane manufacturing, say, or tennis is the example I always use. So it's basically a huge, you create a huge database of called a knowledge graph of subject verb object associations, like tennis player is to racket, is to ball, is to court. So you teach your AI a worldview, a common sense. And so there are 3 companies in the US that index the entire public web, and they are Microsoft, Google, and another one called Diffbot. And Diffbot is creating a knowledge graph of the entire public web in every language, and has said to us, yes, we're going to enable you to create a COVID-19 knowledge graph. And so that's what Jatin is working on. Jatin, who's on this call, Jatin, who I was talking about earlier. And so what we're going to be able to do with our machine learning model is to have it connect to this knowledge graph and have a worldview about COVID-19 so that it can help it understand it. And the great example of that is if you present to a machine learning model, to AI, in this case, synonyms, so short, commonly used words to replace a long word. The AI can't choose which word is the most appropriate because it doesn't have that worldview and it doesn't have that common sense. And so the more we can introduce that to our model, the better it's going to be at simplifying text. So that's my long explanation for the technologies, the examples of technologies we're using.
Thank you very much, John, for the wonderful explanation. Thanks, Vijay, too.
So I have some more to explain that I would like to ask all of you about. And I can do that now if nobody has anything they want to ask at the moment.
Please go ahead, John. I think that you can continue other topics, and we'll again have a Q&A session once you're done with your next one.
Okay. So another part of the work we're doing is that Twitter has given us access to harvest 10 million tweets per month. And what's been going on for some time now is that Twitter can inform people about earthquakes and wildfires before they experience them, because the speed of the tweets is faster than the earthquake and faster than the wildfire. And so what we're doing with it, and when I say we, I mean 2 young ladies, very smart, both of Indian descent, both with Indian parents. We are going to be analyzing tweets and and basically what we're going to be looking for are outbreaks and clusters and new strains, and present that information in real time to people and simplified to people so that they can see themselves right in their own communities what's happening. And also other people can see what's happening in that community. And when I was investigating this and thinking about India and asking people from India about this, what I was told was that, yes, Twitter is used in India, but it's mainly used by, and I could be wrong, so please, if I'm wrong, tell me, but it's mainly used by people who have education, and maybe it's not used by the everyday person. And what's really used by the everyday person is WhatsApp. And so I'm interested in talking about this because for a couple of reasons. One is as I said, I want to get the word out about the project and as we develop it, to let everyone in the nation know about this great new resource. But also, we also need to get the word out to get everybody's help to create this wonderful new resource. So what I'd like to know from you is, how should we do that? What social media channels should we use? What other ways can we do it?
I see one person, a friend and a volunteer, Giri Lingamala, and he had mentioned that his daughter is volunteering with you. I don't know if that's your project or, so Giri, are you able to unmute yourself?
Hey Ram, I could. Hey John, this is Giri Lingamala. I know you know Shri, my wife. So yeah,
That's what I'm talking about.
I was telling Ram, John, this is a small world. So I know the connection to you and Vision Aid and Shri and my daughter. So it's all like happening in a without pieces are all coming together, right? So I think it's amazing to see what you are doing and then little help that Harika and Shravya are providing.
What a couple of smart, you should be so proud of your daughter. She's a smart young lady and passionate. I couldn't ask for anything more. She's great. And so is, they both are.
Thank you, John.
Thank you, Giri. Yeah, and it's actually Giri and Sri who actually introduced me to John. So thank you for that as well. That, as you can see, that relationship continues and flourishes.
Okay. So go ahead, Rob. Go ahead.
No, just doing a time check. We have another maybe 10 minutes or so, and then we can start wrapping up the event because it's getting late in India. It's going to be 9:30 soon. So just to keep that in mind.
Okay, so well, John, to answer your question, right? Your question, you're right. WhatsApp is the most commonly used channel for communication. I think the penetration of smartphones in India is quite high. I don't know the exact numbers, but I would say it would be close to about 100 billion or something like that. So that and WhatsApp is the primarily used channel, for communication. The second most probably would be Facebook. I could be wrong. I don't have any statistics, but I think Facebook is the second most, I would say. Twitter, probably comes after that, and then LinkedIn and some of the other channels. So yeah, WhatsApp probably will be the best channel to target, actually.
Thank you for that. Mabel is another of my team members who is also on the Zoom session with us, told me yesterday or this week that Facebook, which owns WhatsApp, is soon going to be requiring people to agree to essentially low privacy and or new privacy. That they cannot continue to use WhatsApp unless they agree to the new privacy policy. what kind of effect do you think that's going to have on the use of WhatsApp in India? Anybody?
So John, let me take the first shot at it, but I think the privacy policy is currently being challenged by the government of India, and it could, even if it comes into force, it could eventually be challenged in the Supreme Court. So I don't know if at all it will come. Even if it comes, it depends on what kind of privacy policy, because earlier what LinkedIn, Facebook said was that it was applicable only to business accounts and not for private accounts. Now, we don't know what the new policy would look like, but if it's just meant for business accounts, it shouldn't have too much of an impact, because most of the WhatsApp users are private users. But if it's going to affect the private accounts, then it might have some impact actually. People might choose to switch to other platforms. So we don't know at this point. I think the government is quite against the privacy policy. They have given 7 days notice for Facebook to respond. I doubt if it will ever be implemented actually.
Okay. Thank you for that. I didn't know any of that. I appreciate you sharing that with me. Another question I have is that I know that there are millions of people in India that don't speak English, and how do they get? I'm sure that there are local government entities that publish in their language, but this is not just a English issue. This is a literacy issue, and I know that India has a very high population of people who have low literacy, and so one of the ways that we address that is that you can come to our website and basically press a button, and it will read to you out loud in a voice the text on the page. There's nothing for you to install. It just works, and that way you don't have to be able to read. You can just listen. But I'm curious about anybody's ideas about how we can get our information to people who aren't native language speakers and who are of low literacy, or I should say. Anybody have any thoughts about that for me?
Hello, am I audible?
Hi.
Hi, this is Nibin. I'm a master's student at IIIT Bangalore, and it's a wonderful question, sir, actually. Thank you so much for raising this question. And I do have the same kind of questions to you, actually. Like, if we have a simple button which which gives us the outcome, like the report, whatever in our own language, our own personal language, and how do we make that button? How do we create that button to the button and give it to the person who never access to have phone or never access to have any kind of digital tools? That is also another question I also do have, because recently I do have engaged with a lot of research projects, and particularly about the usability of the digital tools in connection with person with disability. I'm a person with visual disability, so the usability is the big matter in a ground level rather than anything else.
Yes. So I'm sorry. Go ahead.
No. I'm sorry. Go ahead, sir.
Okay, so I have a couple of thoughts about this. One thing I haven't mentioned yet, and I recognize, sir, that you have a visual disability. But another thing that we're doing is we are working with we have a couple of partners. One's called Global Symbols. It's in the UK, and what we're doing is we're working on matching simple text to symbols that are on top of the text, so to help you understand what the word means. and not just symbols, maybe pictures, maybe word definitions, etc. So that's another way we're working to help people to understand text. But going back to this idea of how do we reach people who don't have mobile technology, for example? Well, the way that I've always thought about it, at least in the US, is that we can make printable versions that libraries could print out fact sheets, for example, that are in simple language to help people to understand. And I don't know what kind of system. I know India is a terrifically educated country, but I don't know how. This is another example of how I don't know how to reach the everyday person. Maybe by printing the information, but how do we get that out?
I think Professor, actually one of the prominent practice like applied in India was the IVR technology.
I'm sorry, could you pause for a moment? Ram, could you mute everybody? I'm getting a lot of background noise.
Find people who are
Yeah, shall I?
Yeah, go ahead.
Yeah, so one of the prominent technology is applied in Indian society was the IVR, mobile IVR system. Basically, we can call to a very simple number, for example, 4-digit number, and from the 4-digit number, we will get some IVR based information. This is a best practice is happening in India for most of the government interventions. I hope I was audible.
I think, John, you're on mute.
I didn't realize I was on mute. Sorry. You're talking about interactive voice response.
Exactly.
And so my question for you is that can anybody create an IVR system and publish a number, or is that just controlled by the government?
No, it's a completely centralized system. This IVR mechanism, or mostly it's depends. But at the same time, if it is for a large or a mass information distribution process, it definitely under centralized control by government, no doubt about that. But still, there are specific cellular services, many other digital like companies have been providing the same kind of features, but it is a standard 1800 kind of around more than 12 or 16 digits numbers. But the all the numbers, all the numerics which is usable for a person who never access to the highly sophisticated digital system, definitely under government control, government systems actually.
Yes. So this brings up for me a larger issue, which is that we are doing everything we can independent of government, because we know that governments everywhere move very slowly, and are their decision-making speed is very slow, and also they're in crisis. And so unless we can get to someone high up in the Indian government who can say, who can expedite a system like this, I don't have any hope of it working. And but if that could happen, then we would need, I'd be pleased to do that. And I would need to get resources and people in India to help to do that.
Yeah, but I hope that there are possibilities to make this. For example, I'm as one of the state in India who have the place have a high literacy and all the kind of advanced features, like the living standard comparatively is high in the state. So what happened, every government system have a specific digits, and this kind of systems are not highly complicated, because people, like, I think if the specific intervention make impact, then definitely these the governments will be supportive, right? I assume.
I simply don't know. I don't know if the governments will be supportive or not.
Yeah, it's a long thoughts really about whatever you shared.
Yeah, so a principle that I teach my graduate students is to act without permission and to apologize later for it. So we don't ask for permission first. We just do it, and then if somebody gets mad about it, we apologize later. So that's what we're doing.
Good, interesting approach.
That's a good strategy, I think.
So we have about 5 minutes left and 4 minutes left, and I do want to share two websites which you wanted me to mention. One is Easy COVID-19. So I have this on the screen. Also posted it in the chat for everyone, easycovid19.org. The other one is EasyText.AI. And John, if you have anything you want to say about these two websites, feel free to do that now.
So the Easy COVID project website is where we will be publishing soon our crowdsourcing application, so that we can make it available to the world. And you'll notice on the team page, there are members from all over the world, including the young ladies we were talking about. And there she is. There's Shavaya right there. And also, you'll see there's Jatsin we're just scrolling through, and there's Harika right there. So anyway, we've got a great group, and it's constantly growing. And we're also getting increasingly corporate support. So we have a grant from Microsoft, for example, and others. So I just wanted to shout that out. If you go to the organizations page, you'll see the organizations that are supporting us, and then there are funders that are supporting us, and it's really turning out to be a well-supported effort. And then the EasyText.AI site is, you can read, that's a place that you can read about the technology and what we're doing with it. And the information is written simply, as it should be.
Excellent. Thank you for pointing out those resources. Thank you for a very informational talk, and really for all the work you're doing, and also your consideration for India. So as an Indian, American, as well as someone who believes in accessibility, and supports a cause which is for persons with vision impairment, really want to thank you for your efforts. You have an ambitious goal. We are all, small parts of a big system. We'll do whatever we can to put the message out and support your work. But, all the best for the days ahead for all these amazing projects. And in conclusion, I'd like to request our chairman, Mr. Purandang, to say a few words, on behalf of Junaid.
Ram, prior to that, if time permits, would like to express something in front of John. This is Megha here.
Go ahead, Megha. Yeah, go ahead. And John, right. Megha is one of our, very key persons on the Vision 8 team supporting our accessibility project. So Megha, please go ahead.
Sure. John, first of all, I really appreciate the initiative which you're taking, because I personally realize this, the lack of information and basically a centralized information platform where we can fetch and access all the information easily. Like recently, along with COVID, even black fungus is hitting India. And there is no central information where we can know that, yeah, what exactly a black fungus is, what are the symptoms, and whom it is attacking, and what precautions we can take. Now in India, and maybe this is the case with other countries, I'm not sure, but what happens in India is news talks about something else. So media coverage is something else. And when we go to government websites, the information is something else. And the third is the crowd. So word of mouth. It spreads widely, but what portion of information is valid, we don't know. So ultimately, we are like totally confused, and what part of information we should rely or trust upon, we don't know. So for that, your initiative, I really appreciate. And basically, I really don't have answers to whatever questions you put forward. To the irony, actually, I was having those questions and I thought to ask you, but you were putting those questions. So one portion, like, yes, as you said, placing the information on government websites and using these social platforms. But along with that, I also feel that in India, a basic challenge is lack of awareness. Sometimes information is available, but people don't know where they should reach out or what is the right platform where the information is available. Like that is the story of all the persons with disability also here, that there are so many opportunities, but people are not aware of. And as you said, yeah, the population which lacks literacy, they don't use so much of social networking websites or platforms. And even if the youngsters, those who are using, what I have observed is they basically use to just share pictures where they are traveling or they are having some group lunch or just for fun. But if something useful is shared on such platforms, they just scroll it off. And if you go and ask, they really don't know about it. So these are the basic on-ground challenges, and hope we all will join hands and will work together with you so that a little effort we can take to overcome these challenges for our country. So thank you, John. Thank you so much.
Excellent inputs, Megha. And Megha herself was making us aware of the many challenges she faced when she had COVID and her parents had COVID and all the difficulties in accessing information. So you have first-hand experience. You also conveyed it very eloquently. Thank you so much, Megha. So with that, I will now request our chairman to offer a vote of thanks, and then we can conclude the event. Now, after that, we will keep the meeting open for a few more minutes if anyone wants to stay back. But we will conclude the event formally once Mr. Purandang has said a few words and the vote of thanks, and then stick around for another 5 or 10 minutes after that on an informal basis.
You can hear me?
Yes.
Okay. I'm honored to say a couple of words for John Rochford. It is such an enlightening talk, and it is so good to learn that your research is going to help so many people with vision impaired and victims of other disabilities. That seeing that you have such a brilliant team of people who are doing this research just conveys to me that whatever you are doing, it is going to be a great addition to whatever is available technically in AI, machine learning, and otherwise, which is going to help them. It may create a revolution. And I have one thing. There are so many elderly people who are victim of loss of memory. And you did mention that by way of database and otherwise, that people with disabilities will be able to, read and understand and everything. I would request you, if you can work more on this, so that all these people are not only able to understand what you are writing or publishing, but also some kind of new direction as to how they can improve their memory. I know that is a medical subject, but still, I have so many friends who have loss of memory, and it's very difficult. And so in that direction, with your brilliant mind and with all the research you are doing, one thing I would say, most grateful to you for this talk. It is very enlightening and it's going to help all the people who are suffering.
Thank you so much, Puranji. Thank you for the vote of thanks. And on behalf of VisionAid, I add my thanks to what Mr. Purandang said. We now conclude the event. I'm going to stop the recording. I would